This topic will discuss about the nature of sexual self as part of Unit 2's Unpacking the Self. In this lesson, we will discuss the difference between sex and gender along with the issues like gender identity and gender roles, human sexuality, and self-sexual concepts. What does it mean to have a gender in our society? What does it mean to have a sexuality? Sex. Sex refers to the biological differences between males and females, such as genitalia and genetic differences. The differences between male and female sexes are anatomical and physiological. Sex refers to physical or physiological differences between male and female and intersex bodies, including both primary sex characteristics, which is the reproductive system. Male somatic sexual characteristics are the penis, the scrotum, all of which allow a male to make and deliver sperm. For female, we have vagina, uterus, fallopian tube, clitoris, cervix, and ability to bear a children. Next is secondary sex characteristics that distinguish male and female. For male, it includes facial and chest hair, increased body hair, pelvic build, muscular build, and ability to generate muscle mass at faster rate than female. For females include lack of body hair, thicker hair on the head, rounded hips or figures, mature breasts, menstrual cycle, and so on. Gender. Gender is a term that refers to social or cultural distinctions associated with being male and female. It is generally considered to be a socially constructed concept. Typically, babies born with male sex characteristics are assigned as boys, which is the gender, and babies born with female sex characteristics are assigned as girls, which is the gender. This states that our society seeing gender as only having two options. Many children who are born intersex are forcibly assigned as either boy or a girl and even surgically corrected to fit a particular gender. Scholars generally regard gender as a social construct, meaning that it does not exist naturally, but instead a concept that is created by cultural and societal norms. This means a person's sex does not always correspond with their gender. Therefore, the terms sex and gender are not interchangeable.
The human sexuality sensations associated with intimacy between human beings is human sexuality. Sexuality, mentally, is the way of communicating the fullness of love between a man and a woman. Biologically, it is the way of conceiving an infant and passing the lineage to the next generation. Sexuality encompasses the body, mind, and spirit. So this essay has holistically regards sexuality and does not distinguish the reproductive system's psychological mechanics. Sex is a part of what makes a person human. Being human, the prime function is procreation. However, sex goes far beyond the instinct of procreation. Sex is likewise about pleasure, enjoyment, excitement, and even ecstasy. Added to this earthly delight to the flesh, this is the thrill of physical touching and being touched by another warm body. The surging excitement towards sexual release, the ultimate coming out during the sexual climax, and the pulsating, peaceful afterglow of the relaxing feeling after orgasm. Human sexuality serves both physiologically and spiritually. Sex is one way of lowering one's alienation, isolation, aloneness by physically linking with penetrating and being penetrated with another person at the most primitive levels of existence. Sex gives joy, love, comfort, affection, and at times ecstasy. There are a vast variety of types of human sexuality, including a wide spectrum of attitudes, and sexual orientations differ across cultures and periods of history. Yet, human sexuality's fundamental values are universal and central to what it means to be human. The very aim of human life is linked to sex, marriage, procreation, and family. Sexual orientation is a person's sexual identity in relation to the gender to which they are attracted, the fact of being heterosexual, homosexual, bisexual, or transsexual. It refers to a person's emotional and sexual attraction to a particular sex.
Heterosexual. Heterosexual is a person who's sexually attracted to people of the opposite sex. Boys who like girls and women who like men are heterosexual.
Homosexual is a person who is sexually attracted to people of one's own sex. A sexual interest in an attraction of a members of one's own sex. The term gay is frequently used as a synonym for homosexual. Female homosexuality is often referred to as lesbianism. As a sexual orientation, homosexuality is an enduring pattern of emotional, romantic, or sexual attractions to people of the same sex.
Transsexual. Transsexual is a person who emotionally and psychologically feels that they belong to the opposite sex. Transgender people are people whose gender identity is different from the gender they were thought to be at birth. Trans is often used as a shorthand for transgender. When we're born, a doctor usually says that we're male or female based on what our bodies look like. For example, a trans man is a person who was assigned the female sex at birth on basis on his genitals, but despite that assignment, identifies as a man and is transitioning or has transitioned to a male gender role. In the case of a transsexual man, he furthermore has or will have a masculine body.
Bisexual is sexually attracted not exclusively to people of one particular gender, attracted to both men and women. It is romantic attraction, sexual attraction, or sexual behavior toward both males and females, or to more than one sex or gender. It may also be defined as a romantic or sexual attraction to people of any sex or gender identity, which is also known as pansexuality.
Gender identity is an individual's self-concept of being male or female based on his or her association with masculine or feminine gender roles. Also, gender identity in nearly all instances is self-identified as a result of a combination of inherent and extrinsic or environmental factors. This concept is intimately related to the gender role, which is defined as the outward manifestation of personality that reflect gender identity. Gender role, on the other hand, is manifested within society by observable factors, such as behavior and appearance. For instance, if a person considers himself a male and is most comfortable referring to his personal gender in masculine terms, then his gender identity is male. However, his gender role is male only if he demonstrates typically male characteristics in behavior, dress, and or mannerism. Individuals who identify with a role that is opposite of their biological sex are called transgendered. Transgendered males, for example, have such a strong emotional and physiological connection to the feminine aspect of society that they identify their gender as female. The parallel connection to masculinity exists for transgendered females. Furthermore, a transgender individual who wishes to alter their bodies through medical intervention, such as surgery and hormonal therapy, so that their physical being is better aligned with gender identity, are called transsexuals. They also be known as male to female (MTF) or female to male (FTM) transsexuals. But not all transgendered individuals choose to alter their bodies. Many will maintain their original anatomy, but many present themselves to society as the opposite gender. Sexual concept is the feelings of both partners on how they respond on their sexual desire, either in the same sexes and individuals, whether positive or negative concept and feelings. Sexual concept is a good indicator in the center of the emotion. It is one of the factors to express their feelings. Example, homosexual, both female and male. It's either their relationship have a happy ending or failures. Because attachment style moderates one's sense of self in general and one's expectations about and strategies for approaching relationships. Sexual self-concept may be a good indicator of what kind of relationship we tend to get into and how we tend to behave within relationship with an emphasis on sexual satisfaction. What is sexual self-concept? Sexual self-concept refers to the totality of oneself as a sexual being, including positive and negative concepts and feelings. According to theories, sexual self-concept is described well along three dimensions: sexual self-esteem, sexual depression, and sexual preoccupation. Gila Shapiro, a psychotherapist and certified sex therapist, defines sexual self-esteem as the feelings you have about your body and your confidence level in how you relate intimately to someone else. It's what you bring of yourself, both emotionally and physically, to sex and relationship, what you do with that and how you share that with someone else. Sexual self-esteem affects every sexual choice you make. In a person with depression, these chemicals are out of balance. As a result, sexual desire is low or non-existent. In addition, low levels of some of these chemicals can dull pleasurable feelings. The strain that depression places on relationships can further interfere with sexual function and pleasure regarding one's sex life, and sexual preoccupation defined as the tendency to think about sex and to excessive degree. For coupled and single participants, higher sexual self-esteem and lower sexual depression were associated with higher sexual satisfaction among coupled participants. Anxiety and avoidant attachment both predicted higher sexual depression and lower sexual self-esteem. Coupled participants, on average, had a more positive sexual self-concept and higher levels of sexual satisfaction.